Hi, this is Dr. Christy from Body Bar MD, and today I am talking about my approach to weight loss and weight management. For starters, I have a secondary board certification in obesity medicine, which basically means I took a lot of education specific to obesity medicine and then took a certification exam. I did that 10 years ago now. So I've been in this field for quite a while, certainly before we had some of the newer medications. I have worked at a bariatric surgery center doing non-surgical weight loss, and then started Body Bar MD was originally Live Light Clinic, and it was set up as a weight loss only practice in 2014. My PAs, my PA Dina has been doing this for well over a decade. So, combined with myself and my other practitioners, in addition to Dina, we have a lot of experience in this field. And honestly, I can tell you that the program that we do works. On average, most people that are doing our program can expect to see a 10% body weight loss in 3 months. So if you weigh 200 pounds, that's going to be 20 pounds in 3 months. And we expect that weight loss to continue. I definitely take a stepwise approach to weight management. It is absolutely my belief that obesity is a metabolic condition. It is metabolic dysfunction. It starts with insulin resistance. And we know that to be the case whether or not the labs show anything. Obesity in and of itself is an insulin resistant inflammatory state. So we kind of know that, and we approach it certainly initially is just looking at all of the pieces and helping people understand that it's so much more complex than eat less, move more. There are a lot of things going on. Genetics, the environment, really what our bodies were designed to do. And then that doesn't even factor in the food supply that we're dealing with. So I kind of like to start things off on an easy button. So that's going to be what I call kind of a metabolic reset or a metabolic washout. I don't want you to have to think. I don't want you to have to prepare. I don't want you to feel like you're on a diet. We know that we don't want you to be hungry, and we want you to see some initial weight loss. And we're not talking this, rapid, but it's not uncommon for people to see a 3 to 5 pound weight loss in even the first couple 2 or 3 weeks on our program. So we sort of started off nutritionally using some meal replacements. We bring you back in, and that's really where we start the deep dive of personalizing your weight loss journey. Some people come back and they're like, oh my gosh, this is great. I don't have to think. I don't have to do anything. I'm not hungry. I feel great. Let's keep doing this. Same thing. Let's not change anything. Other people, we start kind of fine tuning. They might work night shifts. They might travel a lot. They might, it's kids. They're working on a limited budget. Whatever it is, we start customizing the things that we feel are going to work for them. For some people, that is going to be medications. I start almost everyone at some point on metformin, and that is for the insulin resistance piece of obesity, whether they're pre-diabetic or not. Certainly, if they're pre-diabetic, insulin resistant, or polycystic ovarian syndrome on labs, metformin is likely to be a big part of that. We're not using the metformin to treat blood sugars. We're using it for the insulin resistant piece. There are other medications like phentermine, which is an appetite suppressant weight loss medication that has been around for decades. It is very safe, it's very effective, and it can be used intermittently long term to help people maintain their weight. Certainly, there is semaglutide and Manjaro. Ozempic and tirzepatide are the generic brands of those. And of course, that's what everyone is talking about. Everybody's on the weight loss shot. Again, as I said, I've been around this field for a very long time. There is no doubt that these medications have revolutionized non-surgical weight loss. I have seen patients that are losing the same amount with these medications that they used to lose on that they would used to have surgery for. So the amount of weight loss can be tremendous. Certainly there are some side effects. The biggest side effect that we see is that you can lose 1 pound of muscle for every pound of fat mass, a 1-to-1 ratio, when really it should be 8 to 10 pounds of fat mass for 1 pound of muscle. After, a certain age, certainly after the age of 40, that can be absolutely devastating to the metabolism. It is actually better to gain a little bit of fat mass than it is to lose muscle mass as we age. And then that's not even factoring in other things like our heart is a muscle, our lungs are muscle. I mean, there's a lot of muscle in our body. So we're very cautious when we use them. We do use them, but I like it to be paired with a good nutrition plan that is going to allow us to use the lowest dose for the longest, or the lowest dose for the shortest amount of time possible, and then we wean people off. Most of our patients that get started on them, they're already starting on a nutrition plan. They're eating better. They're making the right choices. We're stressing that resistance exercise. We're stressing adequate protein, so that when they start the medications, they're on a nutrition plan that's going to be sustainable. This is not going to be, oh, I take the shot and I absolutely stopped eating entirely. That is not healthy in any way. It's not good for our brain. It's not good for our muscles. It's just not healthy. And more importantly, it's not sustainable. So we kind of get you started on understanding what's going to be important. We restrict for a period of time, and then over time, it's really going to be adding back the right things in your diet, because there is a difference between eating and fueling your body with nutrition and the things that your body actually needs. So when we do use the medications, again, we're using low doses. The majority of my patients, we don't even have to titrate up. There's no reason to. They're getting adequate appetite suppression along with adequate nutrition and the right kind of weight loss at low doses. Once they get to maintenance, we start a slow wean. Again, we're continuing to check intake, we're checking muscle mass. We start weaning the medicine. It might take once every 10 days, once every 2 weeks. Then it gets spread out to, one shot every 3 or 4 weeks. And at that point, many people can go off it entirely. They might take a little dose once every 3 or 4 months just to keep their weight in check. And we still want people seeing us every 3 months. That way, again, we're checking on their nutrition, we're checking their body composition, and we're seeing how they're doing for the duration. The magic number is 5 years. At 5 years, people are 75% less likely to put their weight back on. So this is a marathon. We've got to be thinking about the long-term health risks and benefits. So that's kind of how we approach it. And again, everyone is individual, but this isn't a program where somebody's just going to get their medication and show up every 3 months and just get more medication or a higher dose. We're really focusing on doing it evidence-based. We're following the data. We're following your body composition. We're keeping it individualized to you, and we're thinking about your long-term health, and making sure that you achieve not only a weight loss that is achievable, but one that is sustainable for the duration. I'd be happy to talk with anyone in more detail about this complicated field, and just the whole idea of metabolic health overall, because it is more than just weight. So if you're interested or you have any other questions, check us out at bodybarmd.com or give us a call at 317-344-0930.